Hi, my name is Mike Pauley. I'm from New Hampshire. I'm Dr. Matthews Kaufman's patient. My journey started 23 years ago. I went in for a routine hernia operation, and after my 10 days of recoup time, I jumped into a pool to go swimming. I came up out of the pool, and all of a sudden I didn't have the same amount of air that I normally have. So the brain started panicking, my limbs started getting heavy, I was scrambling to get out of the pool. So I said to my wife, I think there's a problem. There's a problem with my air. So we started contacting the doctors, the surgeon, to try to figure out what happened. We went through all the different doctors. We had one doctor trying to treat me for a collapsed lung because on the x-ray they took, the lung looked collapsed. So we tried that. No, that didn't work. So we finally met up with a specialist in Connecticut, a pulmonary specialist. So that's where I went into to get my sniff test. And if everybody's aware of the sniff test, they roll the fluoroscope up to you. When you sniff, both diaphragms are supposed to pull down. My right one pulled down, my left one did not. So when I talked to the doctor, he says, yes, you have a paralyzed diaphragm of the left side. So he says, this happened during surgery, so maybe the nerve got torn. So if the outer sheath is still good, intact, it could regenerate itself. So let's wait 2 years. So we waited 2 years. I said, 2 years is nothing. So after 2 years, I went back, did another fluoroscope. No, same. So he goes, unfortunately, there's nothing we can do. Now this is 2001. So now I had to deal with no air, getting winded, tying your shoes, getting winded, going to the gym, up the stairs, everything that I normally did. But the biggest problem was, you got to remember, is when you have a paralyzed diaphragm on the left side, everything raises up. Now you have a void. Your stomach fills that void. So now your stomach goes over and it goes up. Now you have stomach cramps. Stomach cramps for 23 years. So this whole situation, kept going throughout my life. Then one time I was sitting around with my brother Roger and my nephew Connor, who is a NP. He says, hey, let me Google this. So he Googled it, and Dr. Kaufman's name popped up. I got all excited. I said, all right, this is what we're gonna do. So I got on the horn and I just started saying, what do I need to do? So they said, all right, this is what you need to do. You gotta get these tests done, blah, 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 blah. You gotta send everything in to make sure you're a candidate before you even come down. So I sent everything in and they said, all right, you need to come down so we can do a nerve study test on you. Make sure the nerve is still good. So we drove down and we had the nerve test done. Then we're gonna meet with Dr. Kaufman afterwards. All I wanted to do was pass. This sounded great. This is what I wanted. So we get everything done. We meet with Dr. Kaufman. He comes walking in. This guy is top shelf. He comes in and he doesn't think he's any better than anybody else. Sits right down on the stool, looks you right in the face and explains everything. He explains what's gonna happen if you do the surgery, what's gonna happen if you don't do the surgery. He doesn't talk you into it, he doesn't talk you out of it. The guy was awesome. So then after that, he says, any questions? I go, when can I get started? He goes, why don't you drive home and think about it? So I drove home, picked up the phone and called down and said, I wanna do it. So that was in May, so we got the appointment in August. So we came down in August and to have the surgery, and it was awesome, everything. We met here at the office before the surgery, the day of the surgery, and pre-op. Everybody that was gonna be in that operating room came in and introduced themselves to me to let me know what they were gonna do. And then I went into surgery. Post-op, I had a blast. It was a great time. You have your own room. The staff there was great. I got brought up to my room afterwards. You have to walk around, every half hour, try to walk 20 minutes to keep the blood flowing, keep your leg moving. And then after the surgery, you wait for like 4 days to get your drain tube taken out of your incision. Then you head home. Now, when you talk about, was there any difficult times with recovery or anything to that, is the biggest thing I had is it's an hour-and-a-half drive to a PT. There's only one in my state. So now I can't go once or twice a week because when I go, I got to take the day off. I'm not saying it's not important, because it's important. you have to do this therapy. So I would go up and she would show me how to do this therapy. And I'm gonna tell you, it's not easy. You have to learn how to breathe all over again. I've been breathing wrong for 23 years. And it was incredible, all the different ways and the way she was having me breathe. And so we've had many appointments up there, and it's been working. If you're listening to this testimonial now and you're wondering whether you should do this or not, you should do it. You have nothing to lose and everything to gain. I mean, it's the whole procedure's been awesome. The staff's been awesome. Everybody's been top notch.